patience with the technical difficulties that we're trying to resolve in the room. And thank you so much for being here. I want to introduce now Dr. Dan O'Connor, who's going to introduce Daphne, our speaker for today. Dan?
Thank you all for coming. Daphne's an assistant professor of nutrition and obesity studies in the Department of Health and Human Performance, which is also my department. Her health disparities research agenda examines the determinants and consequences of food insecurity and obesity among socioeconomically disadvantaged and vulnerable groups, including racial and ethnic minorities, women, and children. Her graduate and postdoctoral training crossed through several social science disciplines, which has provided her with a unique perspective on these problems, as I think you'll see in her presentation. Her research has been published in many top-ranking journals in the fields of family studies, child development, and public health. Her research has previously been funded by the Robert Wood Johnson Foundation, which is a very prestigious foundation for health research, and is currently funded by the USDA. She was recognized recently by the National Council on Family Relations for having the best professional paper in 2015, and her work has also been recognized by a number of local and national media outlets, including Time Magazine and the Boston Globe. If you've been around long enough, you may have seen her on TV and local stations. I consider Dr. Hernandez to be a valued colleague and a rising star in my department and the university, whose interdisciplinary and transformative work continues to grow and have large impact and influence. Unfortunately, I can't stay. I've seen parts of this before. I have to go to a meeting, but please join me in welcoming Dr. Hernandez to the podium for her lecture, Houston, We Have a Problem, Food Insecurity, Obesity Paradox.
Thank you, Dr. O'Connor, and thank you, Dr. O'Connor, for nominating me for this. And thank you, Faculty Senate, for selecting me for this presentation. I know a number of you, and thank you students for showing up today. I know it's the worst time of year with exams, and I know a number of you have to leave early because there is a 1 o'clock exam, probably even mine. So yes, you may leave early and it's not going to bother me. So just thank you for showing up.
I do.
Wow, okay. So today I'm going to be talking about food insecurity and obesity and talking about those trends on a national scale, but also in terms of Houston. And then I'm going to talk to you about why there is a potential relationship of coexistence between these two factors. And then what I'm going to do is explain how I use this knowledge to create a community-engaged research program, which a number of the students in this room today have been involved in. We're just going to go with it. Okay, so what is food insecurity? So if you have not taken my class, the way I talk about food insecurity to the media or any public forum is I refer to food insecurity as childhood hunger, or as economists have defined it, it is an economic hardship that results in households not having enough money or other resources for food. And in 2014, there was around 19,000 households with children that were food insecure. Unfortunately, in the state of Texas and in Harris County, our rates are above that average. They're around 27%. We are actually one of the hungriest states in the nation. And I bet this is kind of hard to conceive that we have so many children living in households that experience food insecurity when you think about the number of TV shows. There's approximately 200 cooking shows on various networks that explain to you what to do with food. Then there are various sitcoms that are developed around a food environment. So if you're young enough to remember, Happy Days in the 1970s was revolved around a soda shop. Then in the late 80s, early 90s, we had Seinfeld, and they were in a diner. Then came Friends, and they made drinking coffee a popular thing to do. And then in the 90s, we saw Cheers, and then this past decade, we saw How I Met Your Mother, and they both revolved around a pub or some kind of bar. So that's Hollywood. If we bring it down to Houston, there are 11,000 restaurants in Houston. And Houston ranks as, if you look at the number of people that go out to eat, we're in the top 5%, okay? And if you can't find a restaurant in Houston that appeases to you, you can just step out of the city limits because there are 53,000 restaurants in Texas, okay? So what does this all mean? We have shows that show you what to do with food. We have sitcoms that revolved about some food environment. And we have 11,000 restaurants. Basically what that shows is that we don't suffer from a food shortage. Like other developing countries, we don't suffer from famine. What we're suffering from is an inequality between the distribution of wealth and income. So we have a poverty issue on our hands. If we look at a childhood poverty map, we'll see that the darkest shaded blue is where we have the highest rates of poverty. So these are the states where there's between a 25 and 33% of a childhood poverty rate. And so you'll see that the majority of the poverty is occurring in the South. If we then take a food insecurity map and transpose it onto this map, you'll see that the highest rates, actually the rates above the national average, are in the South, while the lowest rates are on the North. So the correlation between poverty and food insecurity is strong. And actually, if we start to think about it, so if we start to look at trends of the past 14 years, we see between 2000 and 2007, there was a steady trend in food insecurity. And so this looks at food insecurity among households without children. So the rate's a little bit lower. So the rate was around 11% between 2000 and 2007. Then in December of 2007, we hit a recession. And there was a spike in our food insecurity. Actually, there was a 30% increase between 2007 and 2008. And since then, we haven't declined. And what's interesting about food insecurity, it is a measure of economic hardship. And if you look at other measures of economic hardship, such as foreclosure, unemployment, those types of other economic shocks, you'll see that food insecurity follows the same trends as other economic shocks. So when unemployment's high, food insecurity is going to be high. And unfortunately, when food insecurity is high, the use of food pantries also increases, and the use of government spending increases. And the reason that the use of government spending increases is because more people are applying for food stamps and WIC. So another trend that's been occurring at the same time, and it's been occurring at a more dramatic rate, is our waistlines have been expanding. So for the past 30 or 40 years, our obesity rates have been expanding and increasing. And it's been a very popular topic. It's been on a number of magazine covers. So in case you missed it. And so if we look at our obesity trends, basically 1994 was the first year that we had trends or data on adult weight status, height and weight status. And you'll notice that in 1994, the obesity prevalence rate was 20% or lower, okay? So at that point, all of the states had an obesity prevalence rate of 20% or lower. 20 years later, every state has an obesity prevalence rate above 20%. Colorado has the lowest prevalence rate at 21%, and then Texas, we have an obesity prevalence rate around 32%. So, and if we take, if we rank ourselves, we're at 11%. We're number 11 in terms of the highest ranking state in terms of obesity. If we look at the past 20 years in terms of our weight status here in Texas, you'll notice that we had a 42% decline in normal weight adults, a 22% increase in overweight adults, and a 140% increase in obese adults in just 20 years. If we take a look a step further and we look at obesity disparities, we see that in Texas, around 27% of white adults are obese. However, when we look at African Americans, that percentage goes up to 41%. And it's just not, this disparity is just not specific to Texas, but it is seen across the US. And then if we look at Hispanics, again, we have a huge disparity of 36% of Hispanics are obese in Texas. So basically, one more disparity. Sorry, there's a lot of disparities. And so if we look at Houston, there's even disparities where people live. So the areas shaded in red are the highest prevalence rates of obesity in terms of our city limits, and our lowest are shaded in blue. Okay, so you'll notice that the areas shaded in blue, which have the lowest rates of obesity, are the areas that are highly affluent, and the individuals there are more educated. So there is definitely a correlation between obesity, poverty, and education and social economic class. So, as the rates of food insecurity have increased, the rates of obesity have increased as well. Is this something that we should take pride in? Not really. Unfortunately, we ranked really high on both food insecurity and obesity, and it's highly prevalent among low-income individuals and Black and Hispanics. Now, what's interesting is, so early election starts today. The election for mayor starts today in early voting. And what's interesting is there's always, when it comes to elections, there's always a lot of Texas pride. We're number one on this, and we're number one on that. You'll never see a politician saying, we rank the highest in terms of food insecurity and obesity. Okay? These are serious problems, but not one that gets a lot of attention all the time from politicians. So something that I get asked a lot is whether obesity is a consequence of food insecurity. And what I can say is that there is a strong association between food insecurity and obesity among adult women. And the results are mixed when it comes to children and adult men. And the reason that I believe that the results are mixed in terms of children is that it really depends on where you slice it, okay? So childhood ranges from all the way from birth to age 18. And it really depends where along that spectrum you're looking at food insecurity and you're looking at their weight. And I'll show you an example later on in the presentation. And then for adult men, why I think the results aren't there yet is because one, it's really hard to get men of any age and of any socioeconomic class to participate in research studies. And and then followed by low-income minority immigrant men, it's going to be even harder to get them to participate in studies. So if you want to look at this disparities between adult men and adult women, what you really need to do is use a large public health data set. So what I state is, instead of saying that yes, obesity is a direct consequence of food insecurity, I just like to say that they coexist. There are many reasons why they coexist. Because we started behind, we're a little bit behind time, I'm not going to really discuss all these points, but I am going to highlight the first three, which is where my area of research has really focused on. So the first one focuses on limited resources. So limited resources as a reason why food insecurity and obesity coexist. So if we look at the wages needed to afford a 2-bedroom rental unit in the US, you'll notice that it takes a wage of over $16 an hour to afford a 2-bedroom unit. Our minimum wage is $7.25. Really hard to afford a 2-bedroom unit on minimum wage. So if we take a step back and look at the hours of minimum wage needed to afford a 1-bedroom unit, in Texas, you need to work 73 hours a week at minimum wage to afford a 1-bedroom fair market price unit. That is practically 2 jobs. You want a 2-bedroom unit, you need 92 hours of work, which is 2.3 full-time jobs. So you're probably wondering why I'm talking about wages and why I'm talking about housing when you came to hear about food insecurity and obesity. Well, it happens so that when you can't afford your rent, when you can't afford your mortgage, things start to spill over and affect other household needs, including food. For the past year, I've been collaborating with the Houston Food Bank on a project called Community Voice Project, which a number of my undergrads have been also engaged with. And through that project, the students are going out to community pantries and trying to get an idea, what are the barriers to food? And one of the barriers that were highlighted was rent and medical expenses as being a barrier to food. As one client stated, I receive $733 a month in total and pay $565 a month for rent. After paying rent, there's utility bills and medical expenses. I'm left with almost nothing. Another client, most of my check goes to rent, then there's utilities, what's left goes to doctor's appointments, medication, and transportation. I'm left with less than $20. And then another client, I never needed food assistance until I got diagnosed with lung cancer and couldn't afford any work anymore. Right now, I'm receiving disability, Social Security income, and SNAP food benefits, but they don't take care of everything, so places like this food pantry help pick up the slack. Unfortunately, for some individuals, housing hardship ends up with them being homeless. And the inability to provide a home address at some of these pantries then causes greater vulnerability and a greater barrier for food. I'm living in a friend's garage and try applying for SNAP benefits, but it's hard having to explain my living situation. Another client, my house burned down after someone in the housing complex accidentally started a fire. I moved to the field across the street. I didn't know where else to go. So what these food pantries do provide for a number of these individuals is a sense of community. And it not only does it form a sense of community, but it helps with the lack of resources. As one client put it, I've been coming to Jordan Grove for years. They're not shameful towards me. The impact and sense of community here is ginormous. I'm a US veteran and currently homeless, so this place is definitely needed. And then another client, I've been homeless for the past 11 years and I wanted to find a job, anything. I'm also trying to find housing. This pantry makes it a great impact on my life because you have a place to go. So these pantries provide not only help with the resources, but also creates a sense of community for these individuals. Another reason why food insecurity and obesity coexist is due to the lack of access to healthy and affordable food. So this is a map of the greater Houston area. these are all the food deserts in the Houston area. So food deserts are areas of town where grocery stores are over a mile in distance. If we then add the areas of town that have low vehicle access, you'll notice that the area is even greater. The star represents where the majority of my work has focused on, and you'll notice that the star is not necessarily located in a food desert, but the surrounding areas where the clients live is surrounded. It is a food desert. This is a study that I conducted with Drs. Reitzel and Obasi, and it looks at the built food environment. And basically on the picture on the left, it is the density of fast food restaurants in the Houston area, compared to the right, which is the density of grocery stores in the Houston area. And the higher the density is where there's a darker color and a lot more dots. So the darker color represents greater density. And what we found is that the areas of town that had greater density of fast food was also related to a higher dietary intake of fat among African Americans. Prior research has also shown that when there is greater density, greater intake of fat, that's also associated with higher BMI. So just because there are food sources available, it doesn't necessarily always mean that it's healthy choices or that it's going to improve their individual's health. And then another area is stress, anxiety, and depression. So something that I've been really interested in is looking, and I think this has developed from my background in family studies, is looking at the family environment and looking at all the risk factors within a family environment. And not only identifying risk factors, but also thinking about how these risk factors get repeated over time, and how this repetition of experiencing these risk factors can then contribute to less resources, less time to prepare food, less time to shop, which then equates to greater food insecurity. So I'm interested in parenting stress, parenting depression, parenting anxiety, employment, parental incarceration, and how these risk factors repeat over time and influence the risk for food insecurity. So within the family environment, there are 4 domains that I've particularly focused on: financial strain, maternal poor health, family disruption, and parenting disruption. And within each of these domains, there are definitely different indicators within each domain that could be contributing to greater financial strain, greater poor health. And when I started this project, I thought, well, obviously, by definition, it's going to be financial strain is going to be the strongest predictor of food insecurity. But what I found was that maternal poor health was one of the strongest predictors in differentiating between the different levels of food insecurity. And this, then I started thinking about my other research, and it really taps into my other research that has shown that there's a possible link between food insecurity and intimate partner violence, and that link is depression. And depression also happens to be a link between intimate partner violence and poverty. And so when I talk about intimate partner violence, again, that's the academic term for domestic violence. And so when I think about depression, depression is a form of stress. And what I think is happening is that the stress associated with food insecurity is diminishing women's physical and mental health. And for that reason, we are seeing a stronger correlation between food insecurity and health outcomes for adult women. If we take a step back and we think about who's responsible for buying the food and preparing the food in most households, even though times have changed, it's usually women's responsibility to do these things. And I think for that reason, we're seeing stronger findings between the food insecurity health outcomes. So what do I believe that needs to be done is I believe that we need to think about more broadly about food insecurity and obesity. We need to move away from this definition that it's all about financial strength. Okay, so even I did it at the start of this talk. What did I do? I defined food insecurity in terms of insufficient money for food. Okay, and even our current policies are designed that way. Our current policies are we give someone an economic benefit and we provide them with basically what I think is a Band-Aid, and I think this is only a temporary solution. If you want to decrease the rates of food insecurity, we really need to think outside the box and have a way to address individuals' mental health, physical health, housing hardship, and medical costs. And when we begin to address these things, we'll be able to decrease our rates of food insecurity. So for the next, I'm going to try to do this in 15 minutes, is I am going to explain to you how I have this knowledge with food insecurity and obesity and how I use this to develop a complementary focus on community engaged research. And so I started to think about what I do and how I have an impact. And the reality is that as academics, we're stuck in our offices writing papers and writing grants, and we think that everybody reads them. But the reality is I know that it doesn't. I even assign them to my own class, and I know you guys don't read it. So I started to think about how do I create a larger impact? So then I started thinking about where I've worked, where I've attended, where I've gone to school, and a number of these universities are in poverty-stricken areas, similar to our outside community here. And I thought, well, why don't I use this knowledge to help the communities that surround me? And so I started to do community outreach, or what is called community cooperative extension. So if you go to a land-grant university such as Texas A&M, it's called cooperative extension. And through community outreach, I'm able to educate the community based on my community-based research. And what's great about this is that you can then use your findings, create tangible products to educate the public. And if you're able to educate the public, then I believe you have a greater outreach. So what I did is for a full year before even engaging in any sort of research, I informed myself and I listened. I spent time with the CEO of community centers, I spent time with staff, I spent time with clients, and listening to them and trying to figure out what are their needs and how can I help you. I volunteered, I handed out food, there was an older gentleman that week after week I tried to give him carrots and he refused my carrots. And I finally asked him one day, why do you refuse my carrots? And he said to me, because I don't have teeth. So then I started to think, and then I observed what he was picking up along the line. And I'm like, oh, that's going to influence his health because he was picking up a lot of bread and a lot of things that were smushy because he didn't have teeth. Another example was I was handing out canned goods, and there was always certain families that wouldn't pick up the canned goods. Canned goods are not perishable. Why would you refuse a canned good? Because they didn't have a can opener. So many times we think we're doing good and we're helping out, but there could be some discrepancy as to why things aren't working. So spent a lot of time listening and informing myself, volunteering. I even had my students volunteer, especially before they do any sort of research project. They're always volunteering, and I really believe that maximizes your impact. About a year and a half ago, I had the wonderful opportunity to teach an honors class where it was a research-intensive class, and through that class, the students learned about research and about collecting data, and they had the opportunity to live a week in the life of a low-income individual. And so for 1 week, they and I myself, I did this too. We lived on $25 a day, and that's the video that I was going to show you, and that's why we're delayed. And I can't show you the video, but we can send the video out. There's actually a couple of students that participated in that challenge that are here today that probably could talk about their experience if you care to listen. And so after volunteering, a lot of the students stayed on to help me collect data. And then we used that data and we figured out how to disseminate the findings. And so you can disseminate findings in various ways. Maybe this will work. I have another audio. Another way to disseminate findings, if we haven't tried it, we're gonna give it a try, is that you can use the media. You can use the media. And media is a great way to get your findings out. And this is an example of one of my undergraduate.
Internet Explorer HTTPS
We're just gonna skip that. There's not there. We'll figure out that later. Yeah, got it. Okay.
I'll fix that.
Can you fix that? Yeah. Okay. So an example of how I integrated community outreach with research is the following. It's a pilot project called Salute that focused on the health of low-income Hispanic mothers and their preschool children. There were two components. There was a maternal survey that focused on food insecurity, maternal health in terms of depression and parenting stress, and their perceptions of weight. And then there was direct assessments where we did height and weight on children, and we looked at their, we took blood samples from mom and child. So on average, kids were 4.5 years of age, mothers were 34.5 years of age. You'll notice that all these families had an income of $30,000 or less. And there was, the majority of these moms were immigrants and had spent time in the US for, on average, 13 years. Only 16% of these households were food secure. So the rate here is a lot higher than the rate in the Houston area and in Texas, but that's because we were targeting a very specific population where the risk would be even higher. 30% of the mothers were overweight, 53% were obese, 68% had an elevated waist circumference, 80% had an above average body fat. So these were mothers that were already 34 years of age and their health had been, were really poor. So one of the things that we also did was we collected blood from the mothers, and the picture on your right is a picture of my undergraduate, one of my undergraduate students who received a summer research fellowship, and she learned how to centrifuge blood and basically prepare blood for it to be analyzed by my graduate student. And so what I'm going to show you is the relative percent change of some of these findings. And so basically what you want to see when you look at these findings is you want all the bars to be below zero. Anything above zero is bad. So you'll see that the mothers that were very low food secure, these are the mothers that experienced the most severe type of food insecurity. They had 11% relative percent change above what is recommended, okay? So glucose is not looking good. LDL, all the bars are above, okay? So that means bad. So there was between a 42 and a 59% above what was recommended. HDL, now your HDL, you want it flipped, okay? You want the bars to be above the zero, not below the zero. And HDL is your good cholesterol. And again, there's between a 35 and a 44% below the recommended. And triglycerides, this is actually the one indicator that they came out good on. So to summarize, majority of these moms were overweight or obese, had above average percent body fat, elevated waist circumference, elevated cholesterol. Kids, the majority of the kids were normal weight. The majority of the kids had a healthy body fat. The majority of the kids did not have an elevated waist circumference. And we also collected blood samples from the kids. And so what we do with younger kids is we collect finger sticks. And this is something I've taught my undergrads and my graduate students. The picture on the right is my current graduate student. She learned how to do this basically on the day that she arrived to Houston. And it's a very simple thing, and the parents love this. The parents really, I was hesitant. You know, you're always told, oh, you're never going to get some blood out of a 4-year-old. Parents love this idea because it's immediate. They were able to know right then and there the results, and that's why it worked. Summarize, the majority of the kids were of normal weight. The kids pretty much had a healthy percent body fat, did not have an elevated waist circumference, and their glucose and their cholesterol and triglycerides were within ideal range. So what does this mean? So somewhere between 4 and 34, something gets derailed. Okay, so something in that 30-year wingspan, something is happening. Why I think we didn't find negative results for the kids was because these kids were very young. So it all goes back to what I was talking about in the beginning. Depends where you slice the pie. These kids were very young, have not been exposed to that many risk factors, and for that reason, I believe they look healthy. But it doesn't mean by the time they get to 34 that they'll probably look different. So this is something, my next step in my research agenda is to follow these children to see where the derailment happens. Something that was innovative that came out of this study was that the majority of studies up to this point have looked at whether or not households are food secure or food insecure. We took it a step further, and I was interested in seeing whether mothers had experienced food insecurity when they were growing up. And 60% of the mothers, or 60% of these households, have experienced food insecurity when the moms were a child, and now when the moms are an adult. So what that means is there's an intergenerational transmission of food insecurity that is occurring. I've been writing about this and hypothesizing it for a long time. Finally, I was able to do a study and to establish and say, yes, there's an intergenerational transmission of food security that is going on. But I believe that through community outreach, we may be able to decrease this transmission. So what my students and I did is that we took these findings and we disseminated. Yes, we wrote papers, and there's papers under review, but we also took the information, we took it back to these community centers and informed these centers. And so we created nutrition education programs. A number of the education workshops include food demonstrations and include recipe cards. The recipe cards include dietary tips, nutrition labels, and food safety recommendations. And these dietary icons was created by a student, and followed by these icons are specific for this community because these are minerals that the individuals in these communities are lacking. So they're able to see that icon and know this is a recipe that I need. We also have 200-calorie models, and so it shows healthy 200 calories versus unhealthy 200 calories. And kids love this model. They go around, there's a happy face and a sad face. And they go around putting happy and sad faces. So happy for healthy, unhappy or unhealthy, and they're quite entertained by this board. So who says you need a smartphone, right? And then we have also a sugar model. Okay, and so through this sugar model, we're able to explain to individuals how much sugar are in water, which is 0, compared to Coke, which is 65 grams. And so, everybody always enjoys knowing how much sugar they've been consuming. We have brochures written in English and Spanish. We have briefs that have also been available. And so what the brief does, it takes the academic article and brings it into a more tangible two-page article that's much easier to read, and it brings home some take-home points. And so that's also been a popular item. Then there's also YouTube clips. One of my colleagues, Dr. Tracy Ledoux, created a YouTube clip that focuses on helping parents with picky eaters. And so this is available on YouTube. And don't worry, I don't have a clip of that, because you know that's not going to work. And so through all of this, through volunteering, collecting the data, creating these tangible products, what has also been occurring is that students have been learning about research. I have, every year, I have a number of students that participate in undergraduate research forum. A number of these students have never stepped in a lab, never conducted any research when they first started. And I even have some that at the end say, hey, that actually was kind of fun. I believe it takes a village to raise a child, but it also takes a village to raise a researcher. These are a number of my mentors and collaborators, just not here at the university, but elsewhere. I would like to specifically thank Drs. Neal, Obasi, O'Connor, and Reitzel here at the University of Houston, who have been instrumental in my development. I would also like to thank Dr. McHire from Texas A&M. And also thank Marissa Ramirez and Jeannie Cleaver, who have been really instrumental in getting my, pushing my research out to the media and just getting it out there. And then there's a whole other group, and that is my undergraduate research assistants. All this work that I presented today, there's no way I could have gotten it done without a slew of undergraduate research assistants. As I stated earlier, a number of these students never have engaged in research prior to being involved in my lab. After being involved for a semester, they became competitive for several research fellowships, travel fellowships, and research scholarships. Some have gone on to even win additional awards, and a number of them are now graduating and are in those coveted RD internships and in several master's programs. In the 3.5 years that I've been here, these students have racked up close to $17,000 in research scholarships. And on that happy note, I would like to end.
I think we have time for 1 or 2 questions, not many, but does anyone have a question for Dr. Hernandez?
In addition to the fast food and lots of grocery stores, isn't there another issue like the mini marts, where most of what you get is chips and cat food?
Yeah, so in these food deserts, what you find are a lot of those convenience stores, liquor stores, and the fast food. So those are the 3. But when thinking about what calculating a food desert, those are not counted, or technically they shouldn't be counted because of the type of food that's available.
Okay. All right, I would like to say thank you so much on behalf of the Community and Government Relations Committee to Dr. Hernandez for this amazing talk, very inspiring. So thank you. next talk will be right here on January 27th, so I hope you can all make it. Thank you.